Bismillahirrahmanirrahim. Assalamu alaikum everyone. Starting with the hadith of the day. None of you truly believes until he wishes for his brother what he wishes for himself. Today, the topic of my presentation is chickenpox, and I'm going to present it under supervision of my professor, Dr. Sarabsal. Learning outlines, introduction, epidemiological trial, chain of transmission, clinical stages, levels of prevention, recent updates, and MCQs in the end. Learning objectives. By the end of this presentation, participants would be able to describe the epidemiological trial in prevention of this infection. Now, introduction. What is chickenpox? It is a very contagious infection caused by varicella zoster virus. Varicella, Latin word used to tell the chickenpox shingles virus from its much more dangerous relative variola, which causes smallpox. Zoster is part of the virus name because it is Greek word for girdle. And a varicella zoster virus is a DNA virus that is a member of herpes virus group. After primary infection, it stays in the body as a latent infection. Primary infection with varicella zoster virus causes varicella. Reactivation of latent infection causes herpes zoster. Problem statement. Global annual chickenpox disease burden includes 4.2 million severe complications leading to hospitalization and 4,200 deaths. In pre-vaccine era, in developed countries, case fatality rate was about 3 per lakh cases compared to 1 to 3 per thousand measles cases. The incidence and severity of herpes zoster increases with age marked after 50 years due to decline in immunity. Adults who reach to 85 years have would suffer at least from one episode of herpes zoster. Epidemiological determinants, agent, host, environment. Varicella zoster virus is its agent. Primary infection results in varicella and recurrent infection results in herpes zoster, that is shingles. Host factors age, children under 10 years of age, few escape until adulthood but can be severe in adults. Immunity, once attacked, it gives durable immunity, for lifetime immunity. Maternal antibody protects the infant for few months. Which is exempt in the absence of immunity. IgG antibodies persist for life and correlate with protection. Cell-mediated immunity is important in recovery. In pregnancy, it is a risk for fetus and neonate. Environmental factors, it shows a seasonal trend occurring mostly during the first 6 months of the year. Overcrowding in temperate climates, there is little evidence of seasonal trend. Source of infection, it is usually a case of chicken pox. Virus present in oropharyngeal secretions and lesions of skin and mucosa. Rarely may be a patient with herpes zoster. It can be isolated from vesicular fluid during the first 3 days of illness. Infectivity period of communicability is 1 to 2 days before the appearance of rash and 4 to 5 days thereafter. It tends to die out before the pustular stage. Patient ceases to be infectious once the lesion have crusted. Secondary attack about 90% in household contacts. Transmission, droplet infection, droplet nuclei, face-to-face or personal contact, portal of entry respiratory tract. Virus extremely labile, so fomites unlikely to transmit. Contact infection plays a significant role when the individual with herpes is an index case. Congenital varicella, it crosses the placental barrier and infects the rest. Incubation period is 10 to 21 days. Pathogenesis, respiratory transmission of virus, replication nasopharynx in regional lymph nodes, repeated episodes of viremia, multiple tissues including sensory ganglia infected during viremia. Clinical features, it varies from a mild illness with only scattered lesion to severe febrile illness with widespread rash. Stages include pre-eruptive stage and eruptive stage. Pre-eruptive stage, in this stage, onset is sudden with mild or moderate fever, pain in back, shivering, malaise, very brief stage lasting for 24 hours. In adults, most even last for 2 to 3 days before rash comes out. Eruptive stage in children, rash is often the first sign. It comes on the day the fever starts. Distribution of rash is symmetrical, centripetal in distribution. That is, it first appears on trunk and then moves to the periphery like face, arms, and legs. Mucosal surface generally involved. Axilla may be affected. Palm and sole usually not affected. Density of eruption diminishes centrifugally. The rash advances quickly through these stages. That is, first the formation of macule, then papule, then vesicles, and then pustules, and later there is scab formation. Pleomorphism, a characteristic feature of the rash in chickenpox. All stages of rash may be seen simultaneously at one time in same area. This is due to appearing in successive crop for 4 to 5 days in same area. Vesicles filled with clear fluid resembling dewdrops, superficial inside. Vesicles may form crust directly. Many lesions may abort. Scabbing begins 4 to 7 days after the rash appears. Fever not high but reservations with fresh crop. Diagnosis, that is, there is prodrome of low-grade fever, eruption of papule vesicles in pustule, typical dewdrop or nose petal appearance, characteristic centripetal distribution. Complications, it's a mild self-limiting disease. The mortality rate is less than 1% uncomplicated cases. However, there are few risks like immunosuppressive patients. In immunosuppressive patients, cancer patients, recipient of organ transplants, chemo, radio, steroid therapy recipients, HIV infected children with leukemia. Shingles. It is a viral infection that causes a painful rash. Although shingles can occur anywhere in the body, it most often appears as a single stripe of blister that wraps around either the left or right side of your torso. After having chickenpox, the virus lies inactive in nerve tissue near spinal cord and brain, and the years later, the virus may reactivate as shingles. Signs and symptoms, shingles usually affect a small section of one of your body, as shown in the picture, and it is characterized by pain, burning, numbness, tingling, sensitive touch, red rage that begins a few days after the fluid-filled blisters that break upon and crust. It is also accompanied with itching. Transmission, a person with shingles can't pass shingles on to anyone else, but a person with shingles can pass on the virus. Second person will develop chickenpox, not shingles. A person who has been vaccinated against chickenpox protected from exposure to a person with active shingles. Congenital varicella syndrome results from maternal infection during pregnancy. Risk appears to be low. Period of risk through first 20 weeks of pregnancy. Varicella laboratory diagnosis, isolation of varicella virus from clinical specimen, rapid varicella virus identification using PCR, significant rise in varicella IgG by any standard serological assay. Differential diagnosis, varicella exanthems, contact dermatitis, symptomatic insect bite, drug eruption, smallpox, and the pox virus. This is the picture showing the difference between smallpox and chickenpox appearance. These are the main differences between smallpox and chickenpox. The main difference is that the distribution of rash in smallpox is centrifugal, however, in chickenpox it is centripetal. And palms and soles are involved in smallpox, however, in chickenpox, palms and soles are not involved. And the characteristic of rash in smallpox is deep-seated, however, in chickenpox it is superficial. Levels of prevention, primary, secondary, and tertiary. We are going to discuss each one by one. Primary prevention includes health promotion, specific protection, and it is done by ensuring high population immunity through immunization. Health promotion, washing hands with soap, especially after visiting public places, avoiding direct contact with infected, recently infected people, using gloves and masks while taking care of people with chickenpox, maintaining a healthy lifestyle to boost immunity levels. Specific protection, there is a vaccine, well-known vaccine, that is live attenuated vaccine. It was licensed for use in US in March 1995. First vaccine to reduce the risk of herpes zoster was licensed in May 2006. Mild local location at inoculation site is 1%. Zero conversion is healthy. Zero negative trial is over 90%. It is a monovalent vaccine, one or two doses scheduled to 0.5 ml subcutaneous injection, duration of immunity probably 10 years. IgG levels are raised in blood to detect lifelong immunity. Varicella containing vaccines, varicella vaccine that is approved for person at 12 months and older. Then comes measles, mumps, rubella, varicella vaccine approved for children 12 months to 12 years. Herpes zoster vaccine approved for person 60 years and older. Varicella vaccine recommendations for children. Routine vaccination is done at 12 to 15 months of age, and then routine second dose is given at 4 to 6 years of age. Minimum interval between doses younger than 13 years of age is 3 months. And the recommendation for adolescent adults is upper all person 13 years of age and older without evidence of varicella immunity. Two doses repeated by at least 4 weeks apart. Don't repeat first dose because of extended interval between doses. MMRV vaccine approved for children 12 months to 12 years of age. Do not use for persons 13 years and older. May be used for both first and second doses of MR and varicella vaccine. Minimum interval between doses is 3 months. Zoster vaccine contraindications and precautions. Severe allergic reaction to vaccine component or following a prior dose. Pregnancy or planned pregnancy within 4 weeks. Immunocompression from any cause. AIDS or other clinical manifestations of HIV infection. High dose corticosteroid therapy. Secondary prevention of spread by the rapid investigation, close contact to ensure the proper treatment. Prevention and control, as we have already discussed about the vaccines, and the another mode of prevention is immunoglobulins. Varicella zoster immunoglobulins, they are given within 72 hours of exposure, has been recommended for prevention. Dose is 1.25 to 5 ml intramuscularly. Used for immunosuppressed contexts of acute cases or newborn contexts, provide improvement in high-risk children with varicella. Control. No specific treatment for chickenpox. Notification. Isolation of cases for about 6 days after onset of rash. Disinfection of articles soiled by nose and throat discharges. Antiviral drugs provide effective therapy for varicella. These are acyclovir, valacyclovir, famciclovir, and foscarnet. Treatment, mild cases, we usually recommend calamine lotion and antihistamines. For severe cases, like and in adults and those who are positive with HIV, they are recommended acyclovir 800 mg 5 times and famciclovir 250 mg TDS for 10 days. Other treatment includes topical antibacterial ointment like mupirocin to prevent secondary bacterial infection and antibiotics. Tertiary prevention of complication deaths by early diagnosis and proper management. Now, coming to recent updates, cold antibody autoimmune hemolytic anemia following varicella infection. Autoimmune hemolytic anemia is a rare complication of chickenpox in adults. Such autoimmune hemolytic anemia is due to warm antibodies, and this is the case report that was reported following chickenpox in young female, and it is concluded in patients presenting with acute onset anemia following chickenpox. Possibility of cold antibody hemolytic anemia must be considered and appropriate testing pursued. Despite lack of empirical evidence, short course of steroid may be beneficial. Drop in hemoglobin is rapid with evidence of fulminant hemolysis showing no abatement after first week. Chickenpox demographics in pediatric patients and their contact burden of disease and vaccine awareness. This study was aimed to determine the chickenpox demographics burden of disease and vaccine awareness pediatric patient. And according to this study, out of 81 primary cases, mean age was 5.3 plus minus 3.3 years with a slight female predominance. Index cases sought medical attention more than contact cases. There was disease burden in the form of school and work absence, significant household cases, misuse of medicines, complications, and poor knowledge about available vaccine. In 81 primary cases, there were 162 secondary cases, showing that chicken pox involvement is more than what is reflected by hospital records. Now coming to MCQs. MCQ number one, chickenpox is a very contagious infection caused by varicella zoster virus. Very rarely a person can get exposed to that virus more than once. Once exposed to the infection, a person can develop chickenpox in as little as dash days. First day, 6 days, 10 days, 1 month, 2 months. C is the right option, that is 10 days. MCQ number two, chickenpox illness usually lasts about 4 to 7 days. The classic symptom of chickenpox is a rash that turns into itchy, filled with blisters, which of the following is true of chickenpox infection. Incubation period is 5 days after exposure. Immune compromised children should be treated with acyclovir immediately after an exposure. Children develop immune protection following chickenpox but can develop the illness a further 2 or 3 times. Vaccination is recommended as part of routine child immunization course in the UK. The incubation period is 2 days after exposure. C is the right option. MCQ number three, a person has painful itchy area near his right shoulder. He has had chickenpox during an outbreak in past. After calling chickenpox, the varicella zoster virus caused can remain in the body for years before it causes shingles, wherein the body does in the virus stay in heart cells, nerve cells, skin cells, in the lung cells, or in the liver cells. Anyone? B is the right option. MCQ number 4. Ali is having small groups of oozing fluid with blister appear a few days later in area of pain and itching, also experiencing flu and fever. He was diagnosed as having shingles. When can a person with shingles pass shingle on to another person? Never, just before the rash appears, while the rash is visible, when fever is settled, after the rash is visible. A is the right option. MCQ number 5. Immunity to disease is achieved when there are antibodies to that disease in a person's system. Parallel lifelong immunity that is achieved when infection is detected by high levels of which of the following? IgG, IgM, IgE, IgA, IgD. A is the right option. MCQ number 6. When a woman has chickenpox in the first 20 weeks of pregnancy, there is a 1 in 50 chance for the baby to develop a set of birth defects. This is called congenital varicella syndrome. It can be acquired by direct contact, airborne transmission, fomites, vertical transmission, respiratory transmission. D is the right option. MCQ number 7. A child presented to OPD with the complaints of high-grade fever, flu for last 4 days, and rash was seen with blisters all over the body surface. Our history-taking physician is asking multiple questions about the pattern of appearance of rash. Chickenpox rash appears first at axilla, face, arms, trunk, legs. D is the right option. MCQ number 8. Secondary prevention of spread of chickenpox done by the rapid investigation of close contacts to ensure the proper treatment. Immunoglobulin levels are recommended to check after how much time in a confirmed case? 24 hours, 36 hours, 72 hours, 80 hours, or 1 week. C is the right option, that is 72 hours. MCQ number 9. Varicella zoster immunoglobulin is made from blood and contains antibodies to the varicella zoster virus. The virus causes chickenpox and shingles. Most suitable recipient of varicella zoster immunoglobulin is a newborn baby, pregnant female, 14-year-old boy, 60-year-old man, or a 2-year-old child. Anyone?
B.
B is the right option, yes. MCQ number 10. A sterile lyophilized preparation of Oka-Merck strain of varicella zoster virus that can be used to prevent varicella, commonly known as chickenpox or herpes zoster, commonly known as shingles. This belongs to which group? Live attenuated vaccine, heat-killed vaccine, formalin-killed vaccine, toxoid, immunoglobulins. Anyone? Uh,
B.
A is the right option, live attenuated vaccine. This is key of MCQs, and thank you for patient listening.
Thank you, Dr. Meha. Very nice presentation.
Thank you, Dr. Naila. Allah Hafiz everyone.